Hi, I'm Catherine with Del Sol Community Wellness, and today I'm going to talk to you about bruising. Specifically, I'm going to answer the question of whether or not you should have bruises after your massage. This has been coming up a lot lately, and it's worth speaking to. I think that what I'm finding is a lot of the confusion is coming from the correlation between massage therapy and cupping. And when you talk about cupping, as my acupuncturist friend will tell you, if you don't have bruises after cupping, then it wasn't done properly. But that is not the philosophy that we would apply to massage. In another video, I talked about whether or not you should experience pain during your massage. And I said that that philosophy of no pain, no gain does not apply to massage. Similarly, this idea that bruising is inevitable, it's natural, it's necessary from a massage, also not true. So I think it might help a little bit if we talk about some of the anatomy, just very briefly, so you understand what's happening when you get a bruise from a massage, because I think it will help you understand why I say that's not a good thing. There are a lot of different kinds of bruises that you can get, and obviously the only one that I'm going to talk about today is the one that happens when you get a massage. So you may know or you may remember that the blood in your body is carried in vessels that primarily break down into two types, arteries and veins. So the arteries are the ones that are carrying oxygenated blood from the heart and the lungs out to your tissues through your body. Returning from the tissues and the rest of your body is the deoxygenated blood, which is carried in the veins back to the heart and the lungs. But at some point, they have to cross, right? The oxygenated blood delivers its oxygen and then it has to get into the veins to come back to the heart. Well, that happens in this really delicate, really intricate, fine web of capillaries. So capillaries are teeny tiny little vessels that have very thin walls to allow for this passage of oxygen and other things that get passed along. This is where you will get a bruise, because what happens when you get a bruise from a massage is that the therapist went too deep, too fast. So that therapist manually forced that blood through those capillaries with such force that they burst. The walls of the capillary actually burst. And so now your blood is no longer in the vessels where it belongs, it's actually in your tissues. Specifically, it's right up under your skin, which is why you can see the dark color of the blood, all those cells. So this is why I'm telling you, you shouldn't have bruises after your massage. Because as I said in that other video, you shouldn't experience pain. Or rather, you shouldn't experience the bad kind of pain. There is a kind of pain, and you should go back and watch that video if you haven't yet, that talks about whether or not you should have pain during your massage. If it's a hurt so good kind of feeling where, yeah, it's like right on the edge and maybe it hurts, but it just feels so good and you kind of just want to like sink in and stay there for a minute, that's a good kind of pain. You're still in a therapeutic zone. Your tissues are absolutely open and receptive to all the work that the therapist is trying to do in there. But when you cross that line and when you get over into that hold your breath, grit your teeth kind of pain, you are no longer receptive to any type of change that the therapist is trying to achieve. So your tissues are on guard, they're locked down, they're kind of in a defense mode, and they're just waiting for it to be over. Well, they're not going to be receptive of anything. So that is not the state that we want you to be in. And at some point, it might have just been like a teeny tiny little blip as the therapist ran over some very, very sensitive, tender spot. But they went too fast, too deep, too fast, and caused a bruise. So a couple things that are worth noting here also are that there are different risk factors, and that makes it sound like bruising is fatal, and that obviously bruising is not a good thing, but it's relatively benign as far as injuries are concerned. So when I say risk factors, all I mean is that there are certain types of tissues and certain types of people who are going to be more prone to bruises of any kind, whether it's from a massage or just bumping their leg on a piece of furniture. So your age plays in, your gender. The biggest thing that I've found is that the tissue type factors in. There are just certain types of tissue that are much more prone to bruises than other types of tissues, which means that when I'm working on those types of tissues, I have to be in constant communication with the patient, and I have to modify my technique, and I really have to be careful about my pressure. So, what to do if you get a bruise? As I say every single time, you have to talk to your therapist. So the next time you come in for an appointment, you have to mention that you had a bruise and you have to tell them where it was. When your therapist hears that information, rather than blowing it off like it's no big deal, and rather than telling you that it's normal and happens all the time, those better not be responses that you get. Because if those are, you need a new therapist, no question. Rather, your therapist should be thinking about where that bruise is, what kind of tissue is there, what kind of technique he or she was using at the time, and whether or not they sensed any pain responses from you while you were on the table. And even if they don't verbalize all those things, that's a much different response than, oh yeah, it happens all the time, that's normal. So if you can't talk to your therapist about this, or if you do and you don't get a positive result, you need a new therapist. There are way too many therapists out there for you to be stuck with a bad one, period. Now then, the other part is that while you're on the table, it is your responsibility to speak up. Just like in that pain video, if you are experiencing pain or discomfort during the session, you have to speak up. Your therapist is paying attention, or should be paying attention to your responses. The response from your tissue, but then also your nonverbal cues to know if they're working too deep or they're using too much pressure or a technique that's not really favorable with you at that point. However, your therapist isn't a mind reader. So some of you guys are so darn good at keeping it under wraps that it's hard to tell if we're hurting you. So you have to speak up. You can simply say, like, that's a tender spot. A lot of people will say to me, because they know, my patients know that I really don't want to be leaving bruises. That is not the kind of work that we need to be doing. People will say to me, that feels like it's going to leave a bruise. It's not quite pain sometimes, but you can feel, gosh, I think that's going to leave a bruise tomorrow. That's the kind of thing we're trying to avoid. So you can simply say, that feels like it's going to bruise. Okay, that's a good indication to me that I need either less pressure, I need to go slower, or I need to modify my technique and use a totally different stroke there. All of those things are possible, and if your therapist can't modify like that, I'll say again, you need a new therapist. There are way too many therapists out there that are really good at this stuff to waste either a second of your time or a penny of your money with the wrong one. You can accomplish way too much change and benefit and healthy gain to be spending your time with a therapist who can't provide those things to you. The benefits are huge. It's too much to waste on a therapist that can't even not bruise you. I mean, who's not even going to take the time to figure out how to not bruise you. This stuff is pretty basic, and if your therapist can't handle this, you got the wrong therapist. So I think before I jump on a soapbox about therapists, I think that's all I have to say about bruising. So if you still have questions or want to talk more about this, you can leave a comment or you can email me. It's delsol massageandbodywork@gmail.com. I do read all of those and I respond. And if you have other questions, same thing, send them to the email. They become videos. Be sure to subscribe to the channel so you never miss a new video. And be sure to follow us on Facebook. We have a lot of good things going on over there. So thanks for watching. We'll talk to you soon.